Good afternoon, everyone, and welcome along to NHS Orkney's annual review. We'll maybe start off with some introductions first of all, and then I'm going to be handing over to John, who's going to lead a presentation for us here this afternoon. Can I also offer up a special welcome to those who are watching us online? And I hope you find the annual review useful and interesting. I'm Michael Matheson, the Minister for Public Health, and I have John Matheson, who's my dad. No, he's who's our Director of Finance at the Scottish Government, who is here to support me during the course of the annual review. And I'll join others to introduce themselves when they start their presentation. But from my perspective, it's always very important to make sure that our annual reviews for our boards are an opportunity to hold them to account for the work that they've undertaken over the last year. Our NHS boards across Scotland are responsible for spending a very significant amount of taxpayers' money each year. Our health budget is just short of £12 billion, and a large portion of that goes to our NHS boards. And it's important we make sure that that resource has been used effectively and is being used well. And it's an opportunity for us to reflect on the progress that the board has made over the last year in taking forward its key priorities, but also to consider how they intend to make further progress in the year ahead, and how they intend to build on the progress they've made, and also to address some of the challenges which they have going ahead as well. As part of the annual review, I've had an opportunity to have a look around the facility here, the hospital, and this morning I also had a meeting with the Area Clinical Forum and the Area Partnership Forum. The Area Partnership Forum is the staff side, the trade unions, etc., and the Area Clinical Forum is the clinicians that come together to discuss issues of that they wish to see being pursued through the board as well, and to get an understanding from them about some of the progress they've made in the last year, and also some of the challenges that they face in the year ahead. And the general sense that I took from both of those particular groups is that there is a good partnership here within NHS Orkney between the board, its clinicians, and its staff side. And it was certainly it left me with a lasting impression of a very positive relationship that can clearly be built upon in going forward to meet some of the challenges which they face. And it was very clear as well that there is a dedicated group of clinicians here who are extremely committed to providing excellent clinical services. And I've got no doubt that many patients benefit from that, because the other meeting I had was with the patients group, and it was very clear from some of the patients that I met there that they were extremely impressed and very happy with the standard, quality, and the way in which they were provided with care by NHS Orkney, and also some of the boards that helped to support NHS Orkney in delivering its clinical services. So that also was very encouraging. As ever, there are challenges going ahead. Integration was a challenge which was highlighted. Issues around communication within the NHS, and as I was saying to some of the patients that I met with, if I was to give you a hierarchy of the concerns that are raised by my own constituents in Falkirk around our NHS, it's not about clinical care or standards of clinical care. It tends to be about communication, communicating with patients and their families and carers, and that's an area which we should always be mindful of and to work to try to address. But overall, the feedback was extremely positive. The format of the annual review has changed slightly to give a greater opportunity for members of the public to raise questions and to make comments about the board's performance over the last year, and to ask them questions about plans for the future. So this session will run for an hour until 1:30, and what I'm now going to do is hand over to John, who's going to lead on a presentation from the board side of things, and thereafter we'll move to a Q&A session. So, John.
Thank you very much, Minister, and welcome to you, to John and to Yvonne Summers, who is our performance manager, who's also here today. On our side, of course, Cathy Cowan, I think, is well known to everyone, and myself as John Roscott. It was interesting, you did mention the meetings you had before. We also had a very interesting walk around the cardiac, to see cardiac patients in their training session, which was quite interesting. And also the emergency retrieval team are here today doing a session with island GPs and a scenario where they've got a very seriously ill patient. And I'm absolutely delighted, as is the Minister, that the patient actually lived. Anyway, good afternoon to you all, and I look forward always to this day, to our annual review, as it gives the opportunity, alongside the people of Orkney and indeed the Scottish Government, to assess the performance of NHS Orkney. The highlight, and to highlight also, as you have also mentioned, Michael, the high quality care services that we have, but also the challenges that are also underpinning all that we do here. Often here in NHS Orkney, we undersell ourselves. We undersell the fact that we do things well, and we treat them, any innovation, as something really that's not so outstanding in part of the day job. And I think we've got to get better at that in the year ahead. We've got to really try and learn to celebrate our success. The main thrust of our activities over the year that we're talking about, and that's 2012-13, has been around transforming service delivery so that it links in with our new integrated hospital and healthcare campus. Change is never easy, particularly for staff at the front line of healthcare delivery. But I know our staff are up for the challenge and look forward to the ultimate prize of a brand new hospital that meets 21st century healthcare requirements. A hospital which embraces modern technology and one which supports an environment where the language of patient safety, improvement and innovation is part of our everyday practice and our everyday culture. I fully accept our transformational change strategy is ambitious, very ambitious in parts, and so it should be, because the people of Orkney deserve it. Doing things better often means doing things differently, not behind closed doors or through the use of smokes and mirrors, but in a truly transparent way that allows our staff and the people of Orkney to be fully informed and feel involved, and therefore part of the direction of travel. As chairman over the past 5 years, I have tried to instill an open and accountable approach to all we do in NHS Orkney. Listening to what patients tell us about their care pathway is a vital part of that journey, and also, if we get things wrong, being totally transparent about what has happened. In so doing, we can enhance a culture where people are at the heart of all we do and how we learn and how we improve. And it was great hearing some of the patient experiences early on today in different sections that we did visit. Our commitment to learning was demonstrated through our first ever staff conference and staff recognition awards scheme last November. It was a huge success, and I certainly, and I know we all do here, NHS Orkney, look forward to our second staff recognition award event in November. So, looking back on the year 2012-2013, quite apart from being building up our outline business case for the new hospital, our attention was focused squarely on building the quality strategy into all that we do here at NHS Orkney, ensuring that all our employees are committed to improving health by improving the patient experience and on the way we invest resources to deliver person-centred, safe and effective care and services. As a result of prudent attention to following that pathway over the course of the past year, I'm delighted to report that the board is currently investing just over £1 million in frontline staffing and services to support high quality care, taking the route forward. But how do we know we're making a difference? Well, the people tell us. Staff reporting of incidents has improved, and patients have given us good feedback on the services we provide. In the past, NHS Orkney Board may have placed more emphasis on balancing its books than in fully embedding person-centred quality processes. But by turning that on its head and concentrating on the care provided, our financial situation, thanks to the efforts of so many people, is now in the best state it's been for over 10 years. As a board, we are committed to listening to and learning from feedback, and the public give us all of that about our services. In the year 2012-13, 44 people were not happy with the service that they received, and as a direct result of these complaints, we introduced changes. And that should be balanced out, really, with the amount of compliments we get for the services almost on a daily basis. A growing concern for many years has been the lack of access to a local CT scanner. And I'm delighted again to report that over the course of the past year, we have accelerated this development. And in advance of the new hospital, we will establish an interim mobile service here at the Balfour early in 2014. As far as the Health and Social Care Integration Programme goes, we continue to work with our partners in Orkney Islands Council and the third sector as we look with optimism to build on what has been achieved to date. Having established Orkney Health and Care with Orkney Islands Council 4 years ago, seems like a lifetime ago, but 4 years ago, we have actually got a head start. We now have a well-established integrated workforce and have invested in a professional structure which embraces the notion of locally based working as the engine room of integration, centred on people and the communities they live in. The Public Bodies Joint Working Bill is the new catalyst that will help guide our local deliberations, most notably with Orkney Islands Council, in providing truly integrated services and, at long last, integrated budgets. Orkney, so much a leader in this field in the past, must continue to look for new and innovative ways to deliver top quality joint services. In so doing, we must aspire to deliver the 2020 Health and Care Vision and the key messages that people across Scotland want. People here in Orkney tell us they want to live longer, healthier lives at home or in a homely setting. And the challenge for NHS Orkney, the Council and Orkney's third sector is making this a joined up reality. Joint commissioning and integrated budgets are one thing. Making this happen within the timescales will be challenging. Most areas in Scotland have already tentatively agreed the direction of travel in either establishing a new corporate body or a lead agency model. We have not done so as yet, but Orkney's can-do culture will make sure we have agreement by next April. In 2012-13, we continued to work hard to prevent infection. However, we saw our C. difficile target exceeded by 2 cases, and that really is 2 cases too many. But on a more positive note, we saw our other infection prevention and control targets being met. We had 2 unannounced healthcare environment inspections to Balfour Hospital, both of which highlighted requirements. And we've embraced their findings because we want and need to ensure that our hospital is clean and safe. Staff have responded positively to that challenge, and their responsibility is no longer diffused. People know and accept their role, their remit, and their contribution. When it comes to performance, we accept targets are only a part of the NHS Orkney story. But in most of our health improvement, efficiency, access and treatment targets, we have a good story to tell. For example, we exceeded our alcohol brief intervention target, which we had missed in years in the past. Our target was 206 and we delivered 359. We exceeded our national uptake rate in bowel cancer screening for both men and women. And in 2012, we had the highest uptake of breast screening in Scotland And after so much effort over the past 2 years by so many people, as I mentioned earlier, we also achieved our Healthy Working Lives Gold Award. When it comes to waiting times, which, Minister, I know it's a keen area of attention nationally, we achieved and exceeded the accident and emergency 4-hour wait and our referral to treatment and treatment times, whilst at the same time delivering on our financial targets. But while we've a lot to be proud of and lots to tell by way of success and achievement, the areas where we know we must do better are in smoking cessation, dementia diagnosis, hospital admissions related to alcohol, and in our support to our locally managed networks for long-term conditions. These are all on our radar. Minister, as I said before, we're not afraid to learn, to be transparent and to seek out views of others. And we did that through our Gibbons report in this financial year. When a member of staff told us at his time of departure that relationships within the hospital among staff were not good, we responded by inviting a team of senior external experts headed by Roger Gibbons and asked them to put our organisation under the microscope, which we did, and they did. And they offered us 20 recommendations that fell into 4 themes, and the board embraced all of these and are currently overseeing their implementation. This we did in the full glare of publicity. Some said that was wrong, but we decided that was the way forward. It was important that NHS Orkney did it that way as part of our drive to tell it like it is and make the whole process transparent to all. We also gained some assurance from the Gibbons review, most notably in being told that our staffing levels were good and that our communications were, if anything, overzealous. Perhaps we were communicating too much in too many different ways, that there was a muddle. Using that process as a catalyst, we've grown up as an organisation. We talk, we listen, and we work together professionally to deliver good care and good services, because this is a clinical business where people matter. On staffing, we have, like many boards, struggled to appoint to a number of posts, but there are now indications that suggest that tide is turning. In recent months, we've managed to appoint to 5 of our 7 consultant vacancies. We now have a comprehensive consultant anaesthetist team. We've appointed 2 out of 3 general physician consultant posts, and the 3rd is due to go to advert. And we have also established links with NHS Lanarkshire to secure consultant rehabilitation time, albeit as part of our virtual ward round concept. In surgery, we have now agreed with our 2 consultants that we go out to advert for a 3rd surgeon, once we have completed our work on potential service repatriation. In obstetrics and gynecology, we've appointed 2 consultants, and we will see gynecology services return to the island as we work with NHS Grampian to repatriate clinical workload. In primary care, like hospital and support services, we have a good workforce and have filled all but 0.5 of a post to ensure a sustainable out-of-hours service. And on the mainland, we have very recently sought the support of primary care management to help us develop a primary care strategy fit for the future and the challenges tomorrow will bring. On our outer isles, our extensive efforts to appoint 2 nurse practitioners to fill vacancies has been less successful. And we're now looking at how we might do things differently to ensure our services there remain safe, effective and sustainable. As always, Minister, I would say NHS Orkney is getting better at what we do as we embrace improvement, integration and innovation. As a board, we're very clear that patient safety is at the top of our agenda and harmful variation is being tackled in ways that are transparent to all. And we shall seek out the voices and the voices of our patients, their families and our staff as we look to support continuous learning and improvement in how we plan, design and deliver care and services. I'll leave you with the story, Minister, that began with a flood. A flood last month that brought an abrupt halt to our ability to provide theatre services. The response right across our organisation was amazing. Everyone got behind us, and very quickly we put in place a temporary emergency theatre, an endoscopy area, and while we could not take the risk of having our expectant mums deliver on island, we made sure that we liaised closely with NHS Grampians so that the experience was as good as we could make it. What was the evidence from all of this? Well, we have a population who work with us. We have staff who go that extra mile for us. And maybe that's why we have the lowest sickness rates in Scotland. And while my chief executive rightly continued to look very concerned throughout the incident, there was an atmosphere that made me immensely proud to be part of NHS Orkney and what we stood for during this extremely challenging time, which was 18 days, although it felt sometimes like 18 years. But we came out of this once again stronger and better. So, as always, I end my annual review speech, and this is where Yvonne gets a bit twitchy and worried, with a random quote. This time, it's not about the year past, but I want to make it about the year going forward and the progress we need to make through innovation. It's a quote from Apple Incorporate, which is entirely appropriate because these things we introduced 2 years ago to NHS Orkney. The iPad. We were the first public board in Scotland to go paper light. We had to face quite a bit of criticism at times for purchasing iPads for all board members. But the use of IT is nothing new to NHS Orkney and in the way we provide services. And through our paper light innovation, we actually saved £20,000 last year and have saved £20,000 again this year. So innovation definitely does pay rewards. To the quote, by making this quote, I would say I'm not advocating we break any rules, Minister, but we think differently. We innovate and we listen. Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs in the square holes, the ones who see things differently. They're not fond of rules, and they have no respect for the status quo. You can quote them, disagree with them, glorify them or vilify them. About the only thing you can't do is ignore them, because they change things. They push the human race forward. And while some may see them as the crazy ones, we see genius, because the people who are crazy enough to think they can change the world are the ones who do. Let us all innovate and embrace change in the year ahead. Thank you, Minister.
Thank you very much, John. John's presentation has given us a flavour of some of the progress that the board's made over the last year and some of the challenges which it faces going forward. And now is an opportunity for anyone who wishes to ask a question to do so. However, before I open it up to questions, I should say that the question and answer session, particularly in a public session like this, is not an appropriate forum to raise personal, individual issues. It's about dealing with general points and general issues that any individual may wish to want to address. There are individuals here from NHS Orkney who are more than happy to take the details of any individual patients or carers who may have a personal issue that they would like to raise, and that can be considered after the public session, and the board will then respond to that issue appropriately. But the public session wouldn't be appropriate for personal detail issues to be debated and discussed. So on that point, can I open up this session for any questions that anyone wishes to raise?
report for adults with learning disabilities living in Orkney, written by Dr. Sandra Rothwell in 2011, and the Autism Spectrum Disorder ASD report and action plan, commissioned by Orkney Islands Council and NHS Orkney, and published May 2013.
Do you want to respond to that issue in terms of where you are?
Pass that on to Cathy from the operational side, who can give you an update on how we're progressing.
As a board, we've obviously embraced both of these reports and we're part in commissioning them. We had a prioritisation process this year to actually make investments in our services, and the learning disability nurse was very much there. This is something that we know that we will have to do. It didn't meet the priority list this year. We invested in high dependency unit and CT scanning, and I could go on and list more. That's not in any way to say that learning disability and the service associated with it is any less deserving. We will look at this next year, and already my Director of Finance and colleagues have started to put that work in motion. So there is a commitment, we've said that publicly, not just to learning disability, but also to cardiology services, and we would actually make sure that that was up there. So thank you for raising that.
Is there a point you want to come back on this particular issue?
Just following on from that, sorry, I'm not used to this. Both Chris and myself are members of the Autism Strategy Group, and we also wondered why there isn't anyone from NHS Orkney or the board on that group at all, because unless you're there in the meetings, you don't know what the issues are. So while you're thinking perhaps it's not the same priority as a CT scanner, we've documented the cases of 7 individuals all asking for an assessment for diagnosis, and that's been ongoing for 2 years. So we would like to know what the commitment is, because so far to date, sorry, we haven't seen it.
Okay, so maybe just to take that point around access to diagnostic services, and the issue is about the local autism strategy which has been developed within the local area around how services should be provided in the future, and the lack of
the access for diagnosis for adults.
Yeah.
Can
I maybe just take a couple of points here, but the issue around there is a national issue around access to diagnostic services, which there's work being taken forward to try and improve that, and Professor Knapp's doing some work at a national level to assist us in helping to improve capacity in that area. And we provided resource at a government level. We provided resource to our local authorities to each develop an autism strategy at a localised level. And the next phase of that is that we are in the process of providing funding for the appointment of regional coordinators, because the mapping exercise has now been completed that you'll be aware of. So we're about to do that as well. But the issue you have is around the around access to diagnostic services for adults, but the other part is around someone from the board not being a member of the local strategy working group.
No board members turned up to any meetings.
Okay.
There's adults still being turned away from.
Could you use a microphone, because there'll be people watching online? So.
Yeah, okay, I'm not familiar with this, but there's no board member turned up to any of the meetings. There's adults today when they're seeking a diagnosis, and it's not the first time that they've been for diagnosis. The ASD coordinator isn't being funded, so we've been told. Yeah, I've just heard that is it the Gibbon report? There was 20 recommendations I just heard talked about. Every 20 recommendations, everyone was implemented?
No, they're in the process of being...
Oh, they're in the process of being implemented. Yeah, from Sylvia Campbell's report for the ASD, the main key point is a coordinator, and we've been told that it's not going to be funded.
Okay.
So I don't think there's commitment there. We hear about commitment, but we don't see any action at all. And there's people who are seeking a diagnosis now, and have been doing for a number of years, and they're at the end of the tether. And this has been brought to members of the board, and nothing's been done about it.
Okay. Can I just, an issue of the coordinator, because I think there may be cross purposes here. Yeah. There is a commitment at a national level for the provision of regional coordinators across the country, and funding has already been agreed for that, and we're about to start that process of taking that forward. They are not going to be based in NHS boards or local authorities. They are going to be based within the third sector. So we're going to work with the national autism organisations to employ these regional coordinators to work with their health boards and the local authorities to coordinate service provision and to then look at how they can assist in implementing the local strategies. Okay, so funding for that at a national level has already been agreed. It's now going to be a case of agreeing with the third sector organisations the recruitment of individuals to these particular posts.
That's totally different than we've been hearing at all the autism strategy meetings.
Okay, so that's a national strategy, not the local strategy.
Yeah,
that's going to
understood. Yeah, there's a lot of the people with wrong questions. One other thing I'd like to mention, that you're on about saving money, and there's a chap that comes up to do the assessment. He was here a couple of months ago to assess 2 adults, and he's coming up in the next 4 to 6 weeks. There's 3 people who come to our support group who are still waiting for diagnosis, who've been refused a referral. And it makes sense to me that when this chap's up here, that he sees these people.
Okay.
It doesn't make sense that you keep bringing him up to see one and then another one and another. He can see 3 people with all his costs, 3 days here for £1,500.
Okay. Can I maybe hand over to the board and ask about getting access to diagnostic services specifically and how you can go about potentially improving that, particularly for adults, where I know there is an issue around getting access to diagnosis.
I'm going to hand this over, but I don't seem to be handing anything over, because when I'm approached to attend any meeting, sometimes I don't get to all the AGMs, but when I'm approached to attend, I go to that meeting and I listen and learn. I'm more than happy as chair to come along to your next meeting. Exactly. I'm more than happy to do that, but I won't pass you on from the operational side to Cathy and see where we are on that one.
I think the first thing to say is obviously the work that Sylvia Campbell has actually led for us. We commissioned that. We wanted to have a very good piece of work that would actually help inform where we were going with those services. And I know that piece of work nationally has been flagged up as an excellent piece of work, so much so that Sylvia is actually over in the Western Isles helping the Western Isles to do similar. So I will speak to both of you after the meeting, and you can share the names with me. You can give me the indications of where these referrals are being blocked at primary care or whatever, and I will give a commitment today to actually address those patients who are actually waiting to be seen by the visiting services, because you are talking about very, very small numbers, and we can actually give that commitment based on those small numbers.
Yeah. I think it's good that you say that, but I've been saying it for a year and a half.
Okay, but we'll get some details after the meeting as well.
Thanks very much.
Okay, I hope that gives you a bit of an insight into the national programme around regional coordinators as well. Thanks.
Hi. Are there any future plans for any services within NHS Orkney or health and social care to be outsourced?
Currently, we're actually looking at home care and actually market testing home care, particularly for those patients who have home care needs that are ongoing as opposed to the acute phase. In terms of healthcare, no, that would not be the right thing to do. We're actually looking in NHS Orkney to repatriate work back to NHS Orkney, and a good example and commitment to that is the gynaecology services, where the board has invested in 2 consultant obstetrician gynaecologists, and for the females in the audience, that's obviously very, very important. I think with the changes in technology, the changes in drug treatments and so on, it's much easier and much safer to actually repatriate work back. And we heard today from some patients who, shared with us that being off island for an appointment that lasts for a very, very short period of time, is that really a good experience? And I think certainly the Minister has passed that to me to sort out, and I would say it's not a good experience. So where we can, we will repatriate, James. We would be certainly not outsourcing any services. It would be quite the opposite from the NHS point of view.
And what Cathy said to you is broadly in line with what we would expect as a government as well, around the provision of NHS services. What we are keen to look at is, with the integration of health and social care, is the role that the third sector can play, the voluntary sector can play, in helping to meet some of the needs of individuals being supported in the community more effectively. The third sector can very often have very innovative approaches and can offer a lot towards assisting in a common outcome, which is to support people more effectively within their own home or homely setting. So we expect our boards to work in a co-production basis with the third sector and with local authorities to identify where there are roles that the third sector can play to help to support local individuals within their own community.
Minister, if I can say, a week ago today, on Monday, Cathy and I went along to the Voluntary Action Orkney headquarters and met the board of Voluntary Action Orkney, and it was an extremely encouraging meeting, very communicative, very together. There were lots of opportunities, not just in the new hospital, but also in primary care as well, for the third sector to have a much bigger role. And I believe firmly that's what integration should do, that it should be a part and parcel of a joint approach to all these types of care facilities.
And I suppose, just so that we don't miss this, we have invested something like 40% of our change fund money with the third sector, because they can actually do things a lot better in some instances than us. So things like the befriending service, a very vibrant, good service, things like the Red Cross and people being able to stay overnight in Kirkwall whilst they wait for ferries and so on. So really thinking about how we make that much stronger going forward is certainly a commitment that the board has signed up to.
Yes, you were speaking about the getting the public feedback and taking notice of it. One way the public can feedback is through the MCN committees and having representation on that. In the past year, it's the number of meetings for the MCNs have actually reduced. Can you give a commitment that in the coming year that these meetings can be re-established?
That's certainly on our radar, Bill, and Cathy, you go for it.
Well, absolutely. And you know that we are committed to coming out and talking to the public. This is your NHS services, and we're public services servants delivering that. So we've actually invested in a number of new staffs in Orkney Health and Care. They're now bedded in. So I would actually see those meetings being re-established. It's not to say that the actions haven't been progressed. So the key commitments that we've said we would actually progress are actually being progressed. But yes, and that goes to the support groups if they want to invite us along to actually be held to account by the support groups in terms of those progressing those actions for you.
Okay. Any more questions? There's nobody else that
It's not like an audience, not to have questions. All right. Okay.
Who's the lead of the
Yeah. What we've asked is through the autism local autism strategies for there to be a clear focus on who should be taking that forward.
Martinez is there.
So the medical director is the lead overall, but we've also asked our local authorities to identify, and we'll provide them with funding for someone to actually take that work forward as well.
The lead hasn't been to any of the autism strategy meetings either.
Yeah,
just thought I'd mention that.
Yeah. So, but one of the reasons why we're working with the third sector for the regional coordinators is it will allow us to keep a closer eye on making sure that we're actually we have people in place who are actually leading in that responsibility as well. Okay. No more questions?
Gosh, I got a grilling last year when
Sorry, another question. Yeah.
Sorry if we're boring everyone. I think we focused a lot more on autism, but I also asked about the learning disability nurse, and there are a lot of people that would like to know, when is Orkney going to get a learning disability nurse, and why haven't we got one so far?
There's actually talks in the board and with Orkney Island Council under the banner of integration within Orkney Health and Care, where we've actually looked at, through Sandra's work, because Sandra was employed by us, as you know, at the number of patients and clients who would require that service. And there is talks about could we integrate both of those posts so it would be a full-time post to actually cover. So that work is ongoing. And I think maybe from your questions, I think we've got a bit to do to make sure that you're getting that feedback. So the commitment the chairman gave about coming along to your meetings, I think we need to do that, because there is things happening. You know, Sylvia's work, I know that you're very cited in that, but that was work that we commissioned to help inform where we were taking services. So I think we need to engage much better with you so that you're picking that up.
Could I maybe add to that, just in regard to obviously the pressures in NHS Orkney through capacity? And often we do have people who maybe have one or two roles that are different, whereas in the mainland boards they may have teams that work on these boards. So sometimes it is really difficult to cover everybody, but we do our hardest to do, our damnedest to try and make sure we do. And that promise is on. I will visit you.
Yeah, thanks. But it's only a little fun, but say visit my meeting. It's not my meeting, it's the Scottish Sources and Strategy. It's not mine. You should be there. Don't be saying come to mine. Yeah, okay, everybody's. Yeah.
Or the chair will be at the next meeting.
I've had the same from the diabetes group as well. I have to be at all the diabetes groups as well.
Yes. Hello. Can I ask a question, perhaps going back to the outsourcing issue? I felt personally the answer maybe deflected from the purpose of the question slightly, because you immediately started talking about the third sector. When I understood the experiment or the trial or the inquiries you were making at the moment were in fact about the fourth sector, about the private sector getting involved. And I'd like you to clarify that for me, please.
We are not engagement in the NHS in Orkney with the private sector. This is a national health service, it's a local national health service. So our links are to neighbouring boards, so to Grampian, to Highlands and so on. What we're trying to do is repatriate, to bring back local services onto Orkney, and that's why we're investing in services like gynaecology. In terms of the private sector for residential care, which very much sits under the arm of Orkney Island Council, if that was to happen, sir, and really the private sector have made they've no chapped in anybody's door in Orkney Island Council for that, then we would go through a process, I'm sure. But the services are provided in Island by Orkney Islands Council in terms of Doonby and all the other residential homes that we have, and they're very, very good services. And I don't think that is on the radar of Orkney Island Council. They're very content to provide their local services, which do very well in terms of the commissioning reports and so on.
We're also very clear at a national level about our boards and any use of the private sector as well, and the priority is about making sure that we deliver services within the NHS. So for example, services that had previously been outsourced for hospital cleaning services, when their contracts were due for renewal, we changed the provisions around that so that they had to be brought back in-house. So our priority is to make sure that the resource remains within the NHS and that the NHS remains a public service. As well, there are occasions when patients will be treated within a private sector establishment because the NHS has not met their waiting time guarantee, where there may be a capacity issue. But what we are focusing our boards on doing is to look at how they can improve the use of their existing capacity in order to repatriate those services back into the NHS as and where. However, that's for a very small percentage of patients nationally. Because private healthcare in Scotland is very, very small in general. But the government's quite clear with its boards is it does not expect its boards to be putting out services to the private sector. These services should be provided within NHS, and where they're not able to provide them, we should be looking to create the capacity to allow us to provide them to patients.
Just a very quick comment on the outsourcing, and Chief Exec's made the point about repatriation and bringing services back, gynaecology services. But there's also local access to off-bay island services. And we did a very powerful example this morning, and it also came up at the annual review about 2 or 3 years ago, about people flying off island for. This morning's example is for a 3-minute outpatient appointment. They went to Grampian for 3 minutes, and the whole day, and the physical trauma, etc., of somebody who's unwell going off island. We've given the board, as we have with the other island boards, the travel budget that they're spending on transportation. and said if you can do it in a more cost-effective way using video conferences, which is not about saving money, it's about something that enhances the quality of services to the local population because they don't have the travel involved, then do that and keep any savings that you make from that. So that opportunity, and I think the quality of teleconference facilities, again, somebody this morning at the Patients Forum said that their daughter's experience was extraordinarily powerful and impressive in terms of the quality of the engagement. And the benefit that came out from the example 2 or 3 years ago is not just the service to the patient being able to stay and do it through a VC link, but the patient's carers and clinicians were round about that discussion as well and able to understand what conversation was taking place.
Can I just add to that in regard to what we're doing to model that type of initiative in the new hospital, because that is crucial. I mentioned the 21st century hospital, but people in Orkney sometimes get the impression that the hospital is going to be kind of just the same as a normal hospital, this hospital here, for instance. It's not. We're looking at some of the real innovative aspects of how we can link with the aisles, and diagnostics in regard to what we do with Grampian and others. So all of that is being looked into. So it's going to be a new tomorrow in some respects. It's going to be a very different type of hospital, if I have anything to do with it.
Okay. Any other questions? All right. Okay, well, can I draw things to a close there? Thank you very much for your attendance here this afternoon. I'm going to be having a meeting with the executive and non-executive members of the board to discuss some issues about their future planning. But I hope you have felt that NHS Orkney have made good progress over the last year, have clearly got further progress to make in years to come, particularly with the prospects of a new hospital facility being provided within the local community. I was very encouraged to hear about the level of clinician involvement in that whole process and staff involvement in that whole process at this stage. And it will be extremely important that the board continue to engage with staff and the local community as they take that plan forward. But I've got no doubt that it will be one which the community in the end will embrace, given it will provide them with a modern clinical setting. So thank you very much for your attendance, and I wish you well. Thank you.
Can I just say a big thank you to you, Minister, and to your team for taking the time out to come to this very important day for NHS Orkney, and to the audience, since I've got the audience in front of me, just to say that at the end of each board meeting, we do have an open forum, which any of you can come along and ask questions of the board. Please come along. Thank you.